Hello, everyone. I'm Lori Carrion, Director of State Government Relations for HMS. Thanks for joining us for today's presentation, Program Integrity, Building a Financial Foundation for Healthcare Reform. During the webinar, all lines will be muted to avoid any background noise. If you would like to ask a question, please do so by using the Send Questions to Staff feature in the control panel. We will address your questions at the end of the presentation. This is the first in a series of educational webinars HMS is presenting on healthcare reform. Our objective for today's webinar is to review two specific requirements created by the Affordable Care Act, the new 60-day rule for providers returning and reporting of overpayments, and Medicaid recovery audit contracts. These are both requirements that can help states cover the costs of implementing healthcare reform because they support stronger programs for both saving money on the front end and also recouping money on the back end. We're all aware that the Affordable Care Act places many new requirements on states as it relates to increased eligibility and the implementation of exchanges. But what is less talked about are the elements included in the federal law that can help offset some of the costs brought on by these mandates. Policymakers are looking for ways to implement healthcare reform in a fiscally responsible way and pay for the increase in eligibility and enrollment while maintaining provider payment levels. States' obligations under the Affordable Care Act are avenues of opportunity, particularly in the areas of program integrity for Medicaid. In fact, program integrity is the foundation upon which the Affordable Care Act is built. Without enhanced program integrity efforts, healthcare reform would create unmanageable costs for states, and the entire effort could collapse under its own weight. Today, we're going to spend time talking about two of these cost savings opportunities, mandatory provider self-reporting and returning of overpayments, and Medicaid recovery audit contracts. If maximized by states, these two new program integrity requirements can be opportunities to financially support some of the costs of your state's healthcare reform implementation. We're not only going to review the available information on these two initiatives, but we'll also explore options that will help you turn these program integrity mandates into opportunities. And to help us do that, we've called upon two of our program integrity subject matter experts to lead this presentation. We'll start with a discussion of Section 6402, which enhances provider accountability of overpayments, led by Kevin McDonald, HMS Vice President of Payment Integrity. Kevin runs HMS's Payment Integrity Service line and works with providers across the country on behalf of our state Medicaid agency clients. And then we'll follow with a discussion of Section 6404 on Medicaid RACs, led by Kim Glenn, Senior Vice President of Government Services. Kim has over 20 years of experience working with state Medicaid agencies to develop and implement cost savings initiatives. At the end, we'll have a question and answer session. So let's go ahead and get started, and I'll turn things over to Kevin.
Thanks, Lori. I'd like to spend a few minutes talking about Section 6402 of the Act and its impact on program integrity. The provision imposes new requirements around providers identifying and refunding overpayments. It's often called the 60-day rule because it imposes a 60-day time limit on when the providers actually have to refund the overpayments that were identified. I'd like to focus on the opportunities this provision affords Medicaid agencies, and specifically how you can improve your current refund process, increase your recoveries, and really importantly, how to decrease your future overpayments before they even occur. So to start, let's quickly review what 6402 actually says. The provision defines an overpayment as any funds that a person or provider receives that they're not entitled to. And once a provider receives an overpayment, they have to refund it within either 60 days of when it was identified or the date of the corresponding cost report. In most instances, providers will be required to refund the overpayment within 60 days because the cost report due date really deals more with providers that receive interim or specialty payments. So the 60-day time limit is important because it will impact your current refund requirements. Each state is different, and your state guidelines may be different than the 60-day timeline, so you need to review the 60-day rule in light of what your current regulations are with your provider community. The rule also states that the providers must notify the payer in writing of the cause of the overpayment. Again, this may be slightly different than what your current requirements are with your providers. The provision imposes significant penalties on providers for failure to comply. Providers that don't comply are subject to penalties under the False Claims Act and civil monetary penalties under the Social Security Act. Penalties start at $5,000 and can escalate very, very quickly. So as you can imagine, with these types of penalties, providers are very focused on ensuring compliance. So that's a brief overview of the specifics of the provision. But to put these provisions or put these specifics in context, I'd like to talk a little bit about the refund environment that currently exists. First, all providers already operate under existing refund requirements. Can we go back to the last slide? There we go. All providers already operate under existing refund requirements. There are state-specific guidelines dealing with how and when providers or refunds are adjudicated, what types of forms need to be completed, what types of supporting documentation need to be submitted, etc. Providers also have internal policies and procedures that they're supposed to follow that document how the refund process is actually performed, who is responsible for refunding, what documentation is required, who needs to sign off on the approvals. So the concept of guidelines around refunding that are in the provision are not new to Medicaid agencies or the providers. But while the rules are not necessarily new from a concept perspective, it does create a strong focus on the entire refund process. Medicaid agencies are focused on how to improve the current refund process and ensuring that all overpayments are identified and recovered, and providers are obviously taking notice of the penalties for noncompliance. So the rules giving all the stakeholders an opportunity to reassess the entire overpayment and refund process. I've talked to a lot of hospital staff over the last few months, and virtually everyone has expressed concern over the implications of this rule. And honestly, their concerns are legitimate. The rule requires providers to refund overpayments within 60 days of when the overpayment was identified, but there's no definition of identified. In the provider world, identified actually means when the overpayment is confirmed, and there could be days or weeks between the time it was confirmed, or the time it was identified and the time it was actually confirmed. Providers could be waiting for weeks for responses from carriers, or maybe they're confirming insurance even exists or that it covers the services that were actually provided. Payers, on the other hand, generally define identified as when a potential overpayment is brought to the provider's attention. So there's a big difference in when the 60-day clock starts to tick if you're a provider versus if you're a payer or state. It's also important to note that the 60-day rule is not a credit balance rule, that it's related to all overpayments. I've talked to some Medicaid agencies who are really reviewing this provision in terms of the context of credit balances. The credit balances are just one small piece of the entire overpayment picture. In fact, it's not unusual for more than half of a provider's overpayments never even show up as credit balances. So with this new focus and energy around overpayment refunds, what are the opportunities for the states that 6402 creates and how to improve the existing process? We're really seeing three trends emerge as states and providers focus on the overpayment process. The first is improving the overall refund process, how providers actually submit refunds, what types of manual processes are involved, what data is collected, those sorts of things. The second area of focus for many Medicaid agencies is making sure that the data is captured in such a way that information can be utilized proactively to improve the overpayment process. And third, we're seeing more and more states focus not just on maximizing recoveries, but also using the information from the refund process to reduce future overpayments. So now I'd like to talk a little bit about each of these three opportunities in some more detail. So the Act's requirements around identifying and refunding overpayments in a timely manner present an opportunity because existing processes can be old and manual and oftentimes have not always kept up with easily deployable technology that makes processing refunds more efficient and accurate. In today's environment, there are oftentimes inconsistencies within the existing refund process. Some providers use electronic refund tools, others use manual forms, some providers even use a combination depending on the situation and the claim volume. Because everyone is doing things a little bit differently, it's extremely difficult to roll out changes or improvements so the process stagnates. If you look at many of the existing processes today, they're not really that much different than they were 10 or 15 years ago. Many Medicaid agencies are also utilizing more than one department to identify refunds. You could have TPL folks involved, you could have program integrity, claims processing, people focused on clinical reviews, in addition to multiple vendors that states may be using. Each of these vendors and initiatives also have their own process in dealing with providers. Because the payment recapture processes are all different, the data that is obtained is too inconsistent to use for any type of proactive analysis or action. We've seen many instances where it's actually difficult for states to even figure out exactly how much a provider refunded across the board and why the refunds occurred, because the data is kept in too many different places. So what's the opportunity? To make the process more consistent, more efficient, quicker, and less resource-intensive, states are turning to the Internet or electronic solutions. By developing a simple and easy-to-use web portal, for example, you can minimize or eliminate many of the inefficiencies or paper processes. Web solutions are flexible and easy to update, and PHI information can be easily protected. You can also utilize simple tools such as pre-populating information to reduce the burden on providers and increase accuracy. A web-based portal also supports maintaining and capturing information in a single database, which is critical to be able to act upon the information to maximize recovery and reduce future overpayments. Web solution also allows for standard process for all stakeholders, state agencies, providers, and vendors. Especially for providers, having a single point of entry for all refunds is much easier to manage. They don't have to worry about writing checks for some refunds, doing manual refunds for other claims, and electronic refunds for a third batch of claims. There are lots of benefits of using a standardized web portal for a payment recapture process. First, it reduces the burden of processing refunds for everyone, states and providers. A well-designed solution allows a provider to quickly retrieve a claim, enter a few data points about the refund, and submit the claim. This type of process also increases the quality and accuracy of the refund process because it eliminates handwritten forms. It can also be set up to require specific data for certain types of refunds, and you can use drop-down menus to standardize options, such as the reason for the refund, whether or not TPL exists, or what type of data you want to capture. One of the issues we see all the time in our provider reviews is a provider trying to refund a claim, and they go back and forth with the state multiple times, correcting information and resubmitting additional information and getting clarification. Having a standard process with required data eliminates these types of issues because it won't allow the provider to submit a refund until the claim request has been completed correctly. A web solution is also easier for states to manage. You can roll out changes quickly and easily by changing the portal. You can update or change required data fields, and you can even notify providers electronically of potential overpayments through the portal. Finally, web-based technology reduces processing delays. Providers don't have to wait for manual adjustment forms to be processed, and states get their money back more quickly. Just as a quick aside, I've talked to a lot of providers about web-based refund solutions, and they're almost unanimously in favor of them. Even if you currently use an electronic process, we'd recommend reviewing the process in light of the 60-day rule and make sure that the process allows for providers to submit the cause of the overpayment and make sure that the claim is adjudicated in accordance with the 60-day refund rule. Another opportunity that states are focused on is how to make the refund data more actionable. There's a lot of information that's currently captured in the refund process, but you want to capture it in such a way that you can use it to maximize your recovery and reduce future overpayments. Today, most data is captured inconsistently at best. Even the same provider may not give the same information on two claims with a similar issue. Because the refund information is inconsistent at the claim and provider level, there's no ability to perform any statewide analysis. You can't identify which providers are refunding and which are not, why providers are refunding, and which providers are outside the norm for your state. What states are seeing as an opportunity is to standardize the information in the payment recapture process, develop consistent reason codes, require the same information for similar refunds of provider types. If TPL is involved, have the provider send the EOB information so that future claims can be cost avoided. Lack of standardization was one of the biggest roadblocks we are seeing in limiting a state's ability to maximize recoveries or improve the process to reduce the burden on providers. In addition, states are now consolidating the payment recapture data and maintaining it in a single queryable format. If you have external vendors, make sure the information is consistent with how the state captures and defines the data. It's the old maxim, you can't improve what you can't measure. So the benefits. The single biggest benefit of consistent and actionable data is the ability to increase recoveries. Knowing which providers refunded claims and which did not, and why they didn't or why they did, allows you to determine which providers are actually not refunding in a timely manner. So, for example, if 80% of the providers in your states are consistently refunding overpayments, it's probably a good indication you should go talk to the 20% who are not. It also allows you to create quantifiable provider scorecards. You can identify providers outside the norms in terms of volume or dollar value of refunds. If the average provider is refunding 1.5% of claims, for example, and you have a provider that is refunding 0.5%, again, you probably want to talk to this provider. Provider abrasion is also reduced because it minimizes duplicate refunds or false positives or incorrect refunds. By knowing which claims are being reviewed by whom, you can reduce the chances of two different payment recapture projects trying to recover the same overpayment. This obviously helps providers, but it also eliminates unproductive work by the Medicaid agencies. Finally, importantly, capturing data in a consistent and actionable format allows you to measure the impact of payment and policy changes. So, for example, if you change the way you're reimbursing a particular claim type, you can measure this impact of the change on the payment recapture process and see whether or not providers are billing correctly or if there's a spike in refunds.